Senator Rosen.
Thank you, Chair Murray, Ranking Member Burritt. I'd really like to thank all of the doctors for being here, for their tireless service to our nation, for their information, for their hard work in studying. And I'd like to just make this other comment that most of us here do understand that data takes time. Good data takes time. Coronavirus is a new virus. It hasn't been around that long. We haven't collected all the data to show us what the trends or variants may be. It's, of course, evolving, and that good data that will help us do the predictions that epidemiologists and doctors like yourselves help to do will be there. It's just a matter of time. I appreciate how quickly you're working on that. But we also have to keep focused, I believe, on treatment options as we have more variants. And of course, people will continue to contract the disease, and we know vaccinations need to go up, but we want to reduce the deaths if you do contract the disease. 5,100 Nevadans have already, over 5,100 have already died from COVID. I don't want to see that going up. And so I have introduced bipartisan legislation to hopefully track a diverse set of COVID patients, long-term, longitudinal study, and report those findings on a regular basis. So, Dr. Fauci, I really appreciated so much the conversations we've had in the past, talk about monoclonal antibodies, other antivirals. We know both have helped. Like I said, people are still dying. So is it an issue of patients not having access to some of these? And what can you maybe tell us about what's in the pipeline for therapeutics for those who unfortunately may still contract the disease?
I had outlined, and I'll briefly repeat it in my opening statement, that we have therapeutics for people with early disease. The difficulty logistically is that getting people early enough to make it work. Monoclonal antibodies clearly work in the setting of getting people before they enter the hospital and before they develop advanced symptoms. Every study that's looked at monoclonal antibodies after a person has advanced disease in the hospital has shown no benefit. We do have good drugs for advanced disease, particularly the state-of-the-art of using dexamethasone with advanced individuals. We have a number of others under emergency use authorization. But getting to the point that I think you're suggesting, Senator, is that the real end game for this is to develop targeted antiviral drugs very similar to what we did so successfully with antiretrovirals for HIV and for curative therapies for hepatitis C. We are now investing a considerable amount of resources in doing that. We have a couple of candidates now that look good that actually had been developed previously that we're putting into phase 1, 2, and 2A and 2B trials. So you're absolutely correct. We need to do better on therapy, and the strategy for the future is the direct antiviral therapies that are similar to what we did with HIV. Thanks.
Well, I'd like to build on that then, because we hear about the long haulers or the long-term effects of COVID-19. We see people really suffering from this. We know about 30% of all COVID patients really continue to suffer from some form of ill-defined symptoms, prolonged fatigue, brain fog, as some people are calling that. It may render folks unable to go to work. It puts them at risk for continued social isolation and other kinds of issues. It may certainly decrease their immune system. And so we have to be sure that we don't deny benefits to these folks who have the long haul symptom. But what can you tell me about, Dr. Fauci, about NIH, how you're evaluating these troubling long-term health consequences? And are there treatments available? What's in the pipeline there for those that are continuing to suffer? Right. Some people sense a smell. I've heard rancid smell. Now they get their smell back, but everything smells sour or rotten. Right. What are you doing?
We've initiated a major program to the tune of $1.15 billion that we're doing at the NIH, also in collaboration with the CDC, and following cohorts of individuals to determine the incidence, the prevalence, how long these symptoms last. We have some studies say they go out up to 8 months or longer. you asked a very relevant question. What about treatment of them? It is very difficult to devise a therapeutic regimen when you don't know what the underlying pathogenic mechanism of the disease is. And that's the real stumbling block here, and why we are intensively studying these individuals, because although it is an absolutely real phenomenon, we don't have any pathogenic mechanisms right now that we're certain of that has a commonality among all of them. We will find that out, and when we do, then we'll be able to devise hopefully appropriate and effective therapies.
Well, thank you. Again, appreciate everything you're doing. Madam Chair, I yield back.
Thank you, Senator Rosen. Coach Tuberville.
Thank you, Senator.